Oh, here's my little peg leg shake. See how she's holding her leg up? See that right there? So when she walks, I mean, she's drinking, she's eating. She can just put a couple toes down. I'm not sure how much better she's gonna get. When she first hatched and started walking around, you know, she was all the way down on that hock. And now she at least can extend it and touch toes. When she's done drinking, I'll show you what I'm doing with her. So here she is. Here's her little bum leg. And I'm just, you know, I've gotten to where I'm going to try to see if you can see this. So I'm just holding her very gently. And then I'll just bend the leg. And then instead of just doing sometimes I'll just work the hock like this. And then sometimes I'll work the whole range of motion. And just, again, I just cannot emphasize enough how gently, with the gentle pressure that I'm using here. Just until I feel the slightest bit of resistance. And then sometimes I'll just massage the little hock area. You know, I'm just kind of like, you know, like the money sign. You know, show me the money. That's kind of what I'm doing. Just getting it. And sometimes I'll massage up the back of her little leg. But if she starts like peeping, see, I'm doing the little money sign. If she starts like peeping or struggling, then I stop. I'm just holding her little foot. Now, I do this several times a day. Just trying to give her, and then sometimes I'll pinch this bone up here, and just like I'll isolate the hock. I know you can't see that. Okay, so you see I've pinched this bone. Ow! The cat just jumped across my back. So I've pinched this bone in between these two fingers, and I'm just working the hock. Do not force it. Okay, PT is over this morning. Look how cute she is. She just put me the heck down, woman. All right, here's something else that I'm doing with her, my little peg leg bird. I'm doing my best to stay out of the camera because I haven't done anything with myself yet. So this is something that I used to work for at the University of Georgia Vet School, and one of the things I did is I helped surgical patients rehabilitate. I kind of did like PT with them, and so the little pedaling of the leg that I was doing, you know, I can't get in the camera. The little leg pedaling and range of motion, that's stuff that I did with surgical patients. Okay, so another thing that I'm doing that I did at the University of Georgia is I'm having her put the weight on it. So I'm lowering her down and I'm bouncing her back up, okay? And I'm just having her put a little weight and adding pressure, just pushing her down slightly until I feel a little resistance. And by doing that, I am hopefully helping to build some muscles in her little legs. So see, I'm kind of giving her a little squeeze here to extend her legs. And then letting them touch my knee. There, see, I'm kind of teaching her to bring her legs down and have pressure on them. Come on, little girl. Well, I know. Got to get her little feet together. So I'm kind of, see how I'm holding her? So that her little feet, I'm kind of pinching right here. So her feet come down together. Okay, she's got weight on them, and I just apply a little pressure to her back. It's just a little bit of resistance there to help build the muscles in her legs and her little toes. See her little toes curling in. So I try to land her feet straight. There. And just remembering that she's only like a day old, or well, this is day 3. Anyway, and you don't want to do but just a few minutes, you know, that's it. And then I put her back. You know, they get tired. She is putting the foot down, but, you know, it's, you know, she's managing. She's better than she was when I first noticed it, when she's just sitting completely back on her hock. She's hobbling around, she's eating, she's drinking. She's got a little bit more extension. I do not know how much more she's going to get, but we'll keep working with her.